Good morning, class. Today our group will be talking about ophthalmic drugs. Ophthalmic medications are essential for the diagnosis, treatment, and prevention of a number of eye disorders and diseases. These drugs are crucial components of contemporary eye care, ranging from treating infections, inflammations, and regulating intraocular pressure in diseases such as glaucoma. Today we'll be covering two major categories of ophthalmic drugs: anti-glaucoma medications with a focus on beta blockers, and ocular antimicrobials. We will also go over how these drugs work, its side effects, and some common patient teachings. So, what are these drugs used for? They can be used to treat infections, inflammation, and increase intraocular pressure. These medications are often administered as eye drops and may sometimes have systemic effects on the body.
There are several drug classes used to manage glaucoma. All of these drugs should not be stopped abruptly. Patients must be educated that abrupt discontinuation of these medications can be harmful and of their adverse effects. These medication classes include beta blockers, prostaglandin analogs, which have fewer systemic effects than beta blockers. This is a first-line treatment drug class with once-a-day dosing at bedtime. This dosing increases patient adherence. Alpha agonists, which are avoided in infants and children. This drug does cross the blood-brain barrier, and therefore oral dryness, fatigue, and drowsiness can occur. Carbonic anhydrase inhibitors are given to those not allergic to sulfa and should be monitored for hypokalemia. Encourage hydration because of a risk for kidney stones. At least 3 liters of fluid a day is recommended. And cholinergic agents. This drug class is known for its sludge mnemonic since it stimulates the parasympathetic nervous system. It is used as an emergency treatment for acute angle closure glaucoma. An example of this drug class is pilocarpine, known for its cosmetic effects like iris darkening and eyelash growth. Teach patients about nighttime vision difficulties due to pupil constriction. In this presentation, we'll be focusing on beta blockers, since they're among the most commonly prescribed for glaucoma. Beta blockers such as timolol, brand name TimeOptic, and betaxolol, trade name Betoptic S, are a cornerstone in the pharmacological management of open-angle glaucoma and ocular hypertension. These conditions are characterized by elevated intraocular pressure, abbreviated as IOP, which, if left untreated, can lead to irreversible optic nerve damage and vision loss. These medications work by selectively inhibiting beta-adrenergic receptors in the ciliary body, the part of the eye responsible for aqueous humor production. Aqueous humor is a clear, nutrient-rich fluid that maintains eye pressure and provides oxygen to avascular structures like the cornea and lens. By blocking beta receptors, beta blockers decrease aqueous humor secretion, leading to a decreased risk of optic nerve damage and therefore hindering the progression of glaucoma. The optic nerve is a structure responsible for transmitting visual signals to the brain. One thing to note about timolol is that it is a non-selective beta blocker, meaning it can affect both beta 1 and beta 2 receptors, unlike betaxolol, which only blocks the beta 1 adrenergic receptor, affecting the heart. Beta 2 adrenergic receptors, which are found in smooth muscle tissues in the respiratory system, blood vessels, and the liver, causes bronchoconstriction. We need to be careful with some patients that may have pre-existing condition in areas of the cardiovascular and respiratory system.
Now let's talk about the side effects. Locally, patients might feel burning or stinging sensation, or have temporary blurred vision right after applying the drops. Systemically, beta blockers can cause bradycardia and even bronchospasms, especially in patients with asthma or COPD. So they're contraindicated in people with certain lung or heart conditions. Also, if the patient is on other blood pressure medications, there could be a drug interaction.
Now, let's look at ocular antimicrobial medications. These are used to treat infections of the eye caused by bacteria, viruses, or fungi. Common conditions include conjunctivitis, keratitis, and blepharitis. Most of these medications are also administered as eye drops and ointment, but in more serious infections, oral or IV medications may be needed. Some examples of ocular antimicrobial drugs are erythromycin, which is a macrolide antibiotic and is the most commonly used macrolide for ophthalmic use. Erythromycin ointment works best at treating bacterial infections like chlamydia trachomatis, which causes neonatal conjunctivitis. Gentamicin and tobramycin are aminoglycoside antimicrobials that destroy bacteria by interfering with protein synthesis. Gentamicin is effective against a wide variety of both gram-positive and gram-negative organisms, and is available as a solution or ointment. It is particularly successful at combating Pseudomonas, Proteus, and Klebsiella organisms, as well as gram-positive staphylococci and streptococci organisms. There's also sulfactamide, a sulfonamide, which is a synthetic bacteriostatic antibiotic that works by blocking the synthesis of folic acid in bacteria. Sulfactamide is the most commonly used ophthalmic sulfonamide antibacterial drug and is available in solution and ointment form. It is used to treat conjunctivitis and other ocular infections. Ganciclovir and trifluridine are used to treat viral infections. Trifluridine is a pyrimidine nucleoside which inhibits viral replication by blocking DNA synthesis by inhibiting viral DNA polymerase. This medication is administered as eye drops and works best at treating ocular infections like keratitis and keratoconjunctivitis, which are caused by HPV type 1 and type 2. Netamycin, a polyene antifungal drug, which treats fungal infections in the eye by binding to sterols in the fungal cell membrane, which causes cell death. This is given topically and is available only in suspension form as treatment of blepharitis, conjunctivitis, and keratitis caused by the fungi Candida and Aspergillus species. Side effects are usually mild, like stinging, irritation, or blurry vision right after applying drops. But some of the most notable side effects to look out for include overgrowth of non-susceptible organisms when using sulfactamide, secondary glaucoma, corneal punctate defects, uveitis, and stromal edema when using trifluridine.
Patient education is really important with ophthalmic drugs. Here are the key points. First, you want to wash your hands before and after using eye drops, and don't touch the tip of the bottle to your eye, as it could spread germs. If using more than one type of eye drop, wait at least 5 minutes between each to avoid washing out one or the other. For beta blockers, teach punctual occlusion, and that means gently pressing on the inner corner of the eye before applying drops. This helps prevent the medication from draining into the bloodstream. As for antimicrobials, emphasize finishing the full course, even if symptoms improve, and never ever share eye drops, as it can spread infection.
To wrap it all up, anti-glaucoma drugs like timolol help lower eye pressure by reducing fluid in the eye. Ocular antimicrobials treat infections caused by bacteria, viruses, or fungi, and proper hygiene and dosing are key for both types of meds. And of course, always educate your patients on the correct usage, side effects, and when to call their healthcare provider. And here are our references.